Hi, I'm Dr. John Young with Foundational Health Center here in St. Petersburg, Florida. And today we're going to talk about a topic that I haven't seen talked about too much out there on YouTube, and it's addiction. Our practice is located in a kind of a middle class type area. We do have some very wealthy, some very poor, and a good amount of middle class folks. But I've really been shocked at the number of people that I have seen that are addicted on the Valium products. Valium is a big one. Valium itself or Xanax, huge problem here in our practice. Then I have a few patients that are addicted to painkillers and some of the recreational drugs that are here in Central Florida, methamphetamines. So I've kind of been forced to really learn how to deal with this. And I think the hardest thing that people have to deal with is when it comes to trying to get off these drugs is just the idea of, am I going to be really sick? How long is it going to take? I want off them, but I'm afraid of all the side effects of it. So a number of years ago, I was reading from some of the things from Cathcart, Dr. Cathcart out in California, John Myers at Johns Hopkins, Klenner at Duke, and realized that IV vitamin C is really, really important if you're going to deal with trying to help people come off these prescription medications, these drugs, recreational drugs, even alcohol. So when it comes to addiction, there's two things that I have found have been the most helpful in my practice. One is IV, intravenous vitamin C. And I give these people IVs maybe twice a week for the first couple weeks of vitamin C, 50 grams, 50,000 milligrams. And what I hear from my patients is, John, it takes that edge right off. I can, wean off quicker my doses of Xanax, things like that. But it makes it so much easier to come off these drugs that we've gotten addicted to. I will say this though, I had a fellow who was addicted to methamphetamines, and before he went off to jail, he came in to get detox, and he did tell me later, says, John, the IV vitamin C really makes a great difference. I had no withdrawal symptoms, none whatever. It's just that when I'm around my friends, and I like my friends, we just do these drugs. So I will say for some of this addiction problems, there also may be a psychological problem. And you want to talk to a counselor about that. But IV vitamin C, I was doing 50 grams IV twice a week for about 2 to 4 weeks on my patients, kind of following them to see how they're doing. And there is one other thing that I've added to my protocol that has taken me even a step further, and some people say many steps further. And it's the use of Enbrel, E-N-B-R-E-L. Enbrel is a drug used in psoriatic arthritis, rheumatoid arthritis. It's a drug you give every week for the rest of their life, and it's used in these autoimmune conditions. But there's some interesting studies out there, and you could Google Enbrel dementia studies, Enbrel stroke studies. It's an off-label use of this drug Enbrel. And the way we gave it is we gave it subcutaneously in the back and then put them in Trendelenburg for a few minutes. And as I talked to one of my patients recently who had been taken off Xanax, he was on Xanax, addicted to Xanax and pain medicines, he said the IV made a big difference. But when you added the Enbrel, the one shot, we actually did his through nasal drops. It just was through the moon, he said. It just made it so easy. And he didn't have the brain fog. He didn't have the desire for any of the drugs. And it really did change his whole life, his whole relationship with his wife. So in looking at addictions, one of the things that I would urge people to look at is this, that we now can do addiction protocols that are not extremely expensive. You're not going away for 8, 9, 12 weeks, but you can do in an office setting. IV vitamin C and Enbrel, subcutaneously or even nasally, has worked wonders for our patients with addiction problems. And it's something that you might want to talk to your doctor about doing if you have an addiction problem, because I think you'll be very pleasantly surprised that getting off some of these drugs may be easier than you ever thought.